What are emergency ambulance services doing to meet the needs of people who call frequently? A national survey. My name is Helen Snooks. I'm a Professor of Health Services Research at Swansea University Medical School. This paper has been co-authored by Ashra Kanom, Robert Cole, Adrian Edwards, Bethan Edwards, Bridie Evans, Teresa Foster, Rachel Fothergill, Penny Gripper, Chelsea Hampton, Anne John, Robin Petterson, Alison Porter, Andy Rosser and Jason Scott. The NHS, as we all know, is under sustained pressure. The emergency care and urgent care part of the NHS, particularly so. 999 calls to the emergency ambulance service increased by 6% every year, although fewer than 10% of those relate to patients who have life-threatening conditions at the time of the call. Responding to patients with less urgent needs compromises the ability of the emergency ambulance service to respond to those who do have life-threatening, time-critical conditions within reasonable response time frames. All UK ambulance services have identified a clinical and operational problem with high users of the 999 service and have set up frequent callers services within the overall ambulance service. Callers who call frequently are known to have complex needs, including chronic health conditions and mental health problems. They're at high risk of further crises, including self-harm and falls, and they have a raised risk of death. Current responses to people who call frequently can be punitive and may simply shift unmet demand from one part of the system to another. There is a lack of evidence about what works in this setting and how. The aim of this study was to describe current practice in the UK in relation to the management of people who call the emergency ambulance service frequently. We used a simple method, a national survey, of UK ambulance services using a structured questionnaire that we developed from a review of the literature for completion by email and followed up by telephone interview. We analysed responses using a descriptive and thematic approach. 12 of the 13 ambulance services that cover the UK responded, 5 by email, and all were followed up by telephone. Our results showed that all services had a designated frequent caller lead and maintained records using nationally agreed definitions about people who made equal to or more than 5 calls a month, or equal to or more than 12 calls in 3 months. These people are defined as frequent callers by ambulance services. In each service, records showed that between 600 and 900 people were meeting this classification per month. Service-wide policies were in place with local variations. Models of care varied from within service care, within the ambulance service, where calls are flagged in the ambulance call centre and contact is made with people who are calling frequently and their GPs, with an aim of discouraging further calls, to case management through cross-service multidisciplinary team meetings to plan care and aiming to resolve callers' needs. Police services were involved as part of the multidisciplinary team or as an option for referral across services and models of care. We concluded that the management of people who make frequent calls to ambulance services is a priority for UK ambulance services, with some national coordination, including the agreement of definitions and reporting. Models of care vary widely, and there are tensions apparent in the provision of care to patients who call frequently, between models which were really focusing on the operational needs of the ambulance service, and these could be sometimes punitive, and clinical, more holistic, patient-centred approaches which focused more on aiming the needs of patients, with reduction in calls and demand being maybe a subsidiary aim. Multidisciplinary case management approaches may help to provide appropriate care and reduce demand on emergency services. However, there is currently inadequate evidence about whether they work and how they work to inform commissioning, policy, or practice development. Thank you for listening. If you have any questions or comments on this presentation, please add them as a comment below the video and we will read and respond. More information is also in our published paper and available at the link shown on screen. The STRETCH study is funded by the National Institute for Health Research, Health Services and Delivery Research Programme.